All right, so TMR. I'm going to try to talk to you guys and not to them. But what do you guys know about TMR?
Only what you told me.
Okay, only what I've told you. What's your perspective of TMR, Matt?
From what you told me too, getting the balance of the body, working the other side compared to the affected side.
Okay, so here's how I explain it to patients, and here's why. And here's why I think it works. And you tell me if something doesn't make sense, just tell me, because I don't want to be doing things that don't make sense. But what I explain to patients and how I go about it is anytime you have any imbalances are caused by pain, stiffness, tightness, soreness, discomfort. You have somewhere in your body, if you have a sprain, strain, any type of pain, any type of muscle spasms, any type of discomfort, other parts of the body are just going to naturally compensate. And what that natural compensation does is causes one side of the body to be tighter than the other, looser than the other, just depending on what the activity is. So if the body is out of balance, right side versus left side, what is that doing to the area that's actually injured? Is that injured area getting the normal pull and stability and motion that it normally would? And the answer is no. True? And you challenge anything you need to, because when you explain that to somebody, and I love getting engineering type of people in here when they're a patient, and they go, well, I did this over here and now I don't know what's going on. And when I have them do the different testing, right side versus left, they're flabbergasted that they're imbalanced so badly. And that's because parts of their body are just trying to compensate naturally for the problem that's going on. And most people have a problem with TMR simply because they go, well, if you're not working on the problem area, how are you affecting the problem? And my answer is, if your body's out of balance and you're having things pull on the area that's affected, and you just work on the area that's affected, is it going to ever, the body can revert once the pain's gone to calming back down. But if it's been set for a while, a little bit of spasming, a little bit of tightness, a little bit of imbalance, what's that going to cause to the rest of the body chain? And the way I look at it is, if you sprain your ankle, you're hobbling around on your ankle until it feels better. You're basically taking a scab that's on your arm and you're ripping it off, thinking, hey, you know what? Okay, we're just going to keep ripping it off until it feels better. And it doesn't make sense when you think of it that way. If you think of a dog who sprained his paw, what does he do? He puts the paw down. If it's painful, he pulls it up. Obviously, we can't walk around on one leg. That's why we walk on the sprained ankle. But that has an effect on the entire body. It affects the knee, it affects the hip, it affects the opposite shoulder, because it's not swinging as much, because that leg is not taking as large of a step. So what I try to explain to patients, and the way I look at it is, all right, how do we balance that out so the imbalances in the body are taken away so that we can focus on the actual problem? And I tell them that knowing full well that when you take the imbalances out of the body, the symptoms in the area that are affected, 90 to 95% of the time are going to minimize, or at least decrease. They're not going to go away, because obviously if you have a torn meniscus, you got a torn meniscus. If you have a sprain to something, it's still going to be sprained. But if you're taking all the unnatural tightnesses, loosenesses, spasms, whatever, the imbalances in the body away, it's naturally going to allow that joint, that muscle, whatever part of the body is aggravated, it's naturally going to allow that to be in a more natural, normal state, even in its injured state. Does that make sense? So that's not being pulled away. Now, is any of this unclear whatsoever? Because most of the time, when people start hearing about TMR, well, actually, when they start doing TMR, they see TMR, they naturally go, well, that makes no sense. But when you start off with the basis of, if there's imbalances and you're looking for the imbalances to balance things out, to try to get the normal balance back into the body, that makes sense, correct? All right, so I briefly tell my patients that, and then I try to explain and say, you know what, if I have a tight muscle down here in my back and don't know it, and I paint all weekend, what's going to happen on Monday morning? I'm probably going to wake up with some shoulder pain, simply because that tight muscle wasn't allowing my scapula to move, or my shoulder blade to move, for you who don't know what a scapula is. And it's going to be causing pinching, and I may not know it as I'm doing it, just because that's my normal movement. But the rotator cuff's going to be pinched, so you go to the doctor, and what's your diagnosis? You got rotator cuff tendonitis, so you get some anti-inflammatories, or they may inject it, or they may just say, just rest and don't paint for a while. And that may all well be good and dandy for your shoulder, because once that calms down, you don't have a problem until you try to go and do some repetitive overhead again, and your shoulder blade's still in the same position because of the tightness of the muscle. True? Unless it spontaneously calms down, which can happen as well. So the 4 motions that I use with every patient, I don't care what they come in with, whether it's toe pain, jaw pain, headaches, concussion stuff. You saw that concussion lady. Knee pain, ankle pain, hand pain. What I do to tell them, okay, what I want to do is try to balance out your body right side versus left. So I have them compare a right shoulder lift with their elbow straight, lifting up as high and as far back as I can, compared to the left shoulder. And then I have them grade it. I say, okay, if your right shoulder is your better one, if that's 100%, what would you grade your left side? And they'll give me a grade, and I'll write that down. So I'll put right side 20% better. And then I have them twist to the right. Then I have them twist to the left. Which one feels looser, more comfortable, less restricted? And most of the time on twisting, they go, they feel about the same. So then what I do is I go behind them, I say, you just relax, and I try to twist them so that their shoulders are perpendicular to their body. And then I try to do the other side, and 9 times out of 10, they're going to feel and you're going to feel a significant restriction one way versus the other. And so you grade that. How does that feel? 100% is good side. What's the bad side? 80%. Okay, so it's a 20% difference. Then I have them do leg lifts. And I have them take one leg lifted up, the other leg lifted up. If they're older and they can't lift their legs, I have them just do a march in place. Compare right side to left side. Which side's better? 100%. Which side? How bad's the bad side? And then I have them do a sit to stand, or if they're older, I have them do a mini squat. Sometimes I skip 1 or 2 of these if they're just not in the type of shape they need to do the action or motion. So what I then do is I look and see where is the biggest imbalance according to their feeling. And I have them work the good side. So if it was a shoulder, I would have them either do 25 lifts. Depending on their age, I might have them do 10 lifts. Sometimes if they had decent motion on both sides and it was just a little tight at the end, I might have them hold at the end and just bounce it. There's different variations that you can do to all these exercises, whether it be just a lift and a hold, and you're just holding it up there for 20 seconds. And it seems to be 20 is about where 20 or 25 is where I use pretty much everything if they're able to perform it. So I'd have them do 25 lifts, or I'd have them do 25 bounces at the end range, or I'd have them hold it 20 or 25 seconds. And I do 2 or 3 sets of the holds. I would do 2 sets of the 25 lifts. I would do 2 sets of 25 bounces. After they're done with that, I would have them go and just check their other side. Most of the time they say it feels a little bit looser, and they give you a strange look and say, how did that happen? If it doesn't, I have them do it again. I always do 2 sets minimally. Not 2 sets, 2, yeah. If you're doing 1 set of 2 repetitions, then I take a break, check it, and I do another set. So I always try 2 sets first. There's general rules to life that they go over in TMR. One is, if it's working, you keep doing it. If it's not working, you try something different. And if it's working and then you get less results, you do a little bit of a tweak to it. So if you were doing 25 lifts, and after a couple sets, they go, yeah, it's not improving anymore, then what you could try is 25 bounces, or try a variation of that. So it's something that I just play with, and you learn over time. The big thing is, though, let's say it was their back that was painful, and they had pain when they were bending over, and that was their symptom. I always try to find symptoms first that are aggravated. If it's their knees, I have them try to do a squat, or I have them try to straighten their leg and lift it. And if that was painful before I had them do the TMR, after I would do 1 or 2 of the sets, if this seemed more balanced, then I would say, okay, hey, how does your back feel when you try to bend over? How does your leg feel when you try to squat? So that they're seeing that I'm tying the balancing of the body to the symptoms. If the symptoms aren't changing and this is balancing out, then I move to the next. Right side versus left side, wherever the second biggest difference was. And in the TMR classes, I think they have the fabulous 6 exercises. The other 2, one is a push into a wall with one side versus the other side. I've only done that on very rare occasions. And then the other one is a toe reach. I think that's one they still use, where they keep one knee slightly bent, the other foot about an inch off the floor, and they compare right side to left side. The only time I ever use that, or the only times I've ever had massive benefit with that is people with migraine headaches. I don't know why, but when you do the good side of that, 20-second holds 2 times when you're reaching with your toes, I've had 3 or 4. I've tried it on about 5 people. 3 of the people who had the migraines, it was at least a 60% improvement. One of them had, actually, my mom was about an 80 or 90% improvement, and the 2 other people were like, "Oh, that's 50% better, but I can live with this." So I'm still trying to figure out whether it's they're holding their breath and they're doing this and that's affecting somehow, but there was a big time imbalance in their balance and in their steadiness. And then once I checked back and the balance was improved, their headache was significantly better. So I don't know the neuromuscular reason for that, but that is how I go through TMR. So if you're watching this, that's my brief overview, and now I get to practice a little in my clinic.